300 children and adolescents die every day from AIDS-related causes. Unicef released this shocking information in its annual global HIV update. It also says that only half of children living with HIV have access to life-saving treatment. Deputy Chief for HIV/AIDS at Unicef, Dr. Shafiq Eshaji, joins us now via Skype. Very good to have you with us, Doctor. Really shocking numbers still today. How come we're still in this situation?
You know, it's just a difficult business. We have to ensure that this is lifelong treatment for children who start therapy. There are real challenges that families, communities, and individuals face with staying on treatment, and we have to make sure that the services are maintained and sustained so that new kids, when they are identified, are able to initiate treatment early, because it's life-saving. Without treatment, children die, and that's why we see these continued high mortality rates. But getting those children tested, getting them started on treatment, and keeping them on treatment for life, and through the life course as they age into adolescence, that's really where the challenge lies, I think.
And is the challenge there because of the fatigue that's often set in when dealing with information about this, the longevity of it?
Yes, I think that's definitely a part of it. It takes people a long time to accept the fact that they have to stay on this treatment. The minute you start feeling better, your compliance rates come down, people's adherence diminishes. And also for health workers, it's just a relentless struggle to make sure that they're continuing to provide the care that they need to provide. So there's an issue of sort of burnout within the health system, but also the challenges that are faced by people living with HIV to maintain their adherence throughout.
The fact that so many children still live with it and die from it, does this suggest that we're failing in stopping it being transferred from mother to child?
Well, that's actually one of the areas where we've had great success. Let's not forget that the transmission rates that we're seeing today are less than half of what we used to see 5, 6, 7 years ago. That's been a really huge and remarkable accomplishment, due largely to the access that pregnant women and breastfeeding women now have to receiving antiretroviral treatment. But even there, we're beginning to see a flat lining of the response. In many countries in sub-Saharan Africa, including in South Africa, levels of coverage are very high at over 90%. Globally, that coverage rests at about 82%. And it's not increasing. Despite efforts over the last few years, we're not seeing a shift in that number of pregnant women started on treatment each year. And that's, I think, because we're up against sort of the margins of exclusion. These are women that are hard to reach, they're hard to retain in care, they're often in rural communities, they're often dealing with multiple deprivations, including poverty. So maintaining that success has really been a challenge for programs.
What are the conversations with men? I mean, I was quite staggered to find out that 500,000 people in Johannesburg are suffering from HIV/AIDS. Not all of them men, obviously, but what's the conversation with them that needs to be had?
Well, definitely access for men in terms of testing and treatment is lower than for women. Most women, especially young women, will be pregnant at some point and they will access antenatal care. And that's been the real linchpin of success for identifying and treating women in general. But for men, we don't have those structures where men routinely go for services. So one of the challenges is reaching out to men, educating them about the value and benefits of testing, and getting them started on treatment. Let's not forget that this is a cycle. If you don't treat men, you're not preventing new infections among younger women, and you're not breaking the cycle of transmission that is resulting in the epidemic that we have today.
Appreciate your time, Dr. Shafiq Eshaji. Thank you.